Afternoon, everybody. I just want to start by saying that if you're interested in this topic, we're going to have more on this topic at the upcoming BC Lung Air Quality and Health Workshop on March 10th, which will be all about the air quality and health impacts of energy extraction, processing, and transportation. We are very lucky to have Dr. Paul VanBuynder with us today. He's the Chief Medical Health Officer for Fraser Health, where the impacts of the Surrey Docks will be felt. Paul VanBuynder provides executive leadership for population health services, including communicable disease control, health protection, and preventative health services. His research interests include vaccine effectiveness studies and the evaluation of programs and marketing to maximize vaccine coverage. He has over 40 publications, so we're looking forward to hearing from him today. Thanks, Paul.
Thank you. Can everybody hear me all right with the mic? Yeah. Okay. I want to start by putting this in context. I am neither a supporter of the Fraser Surrey Docks proposal, nor am I an opponent of the Fraser Surrey Docks proposal. And while the proponent and regulator are marketing an anti-development role for health at the moment, what we're going to talk about today is the assessment of health impacts of proposals, not whether or not something should go ahead. What I'm going to cover is some principles around the activity that we're talking about, talk about the proposal, why the community has concerns about the proposal and why health has concerns, start on the process of a risk analysis for something like this proposal, talk about how we do health impact assessment, and then talk about how we manage community outrage in these sort of settings. So I want to start with three sets of principles. And the first is one that you would be very familiar with, and that is that you need to have an exposure pathway. The fact that a substance exists does not mean it's hazardous. The fact that a substance is hazardous doesn't mean it's either in sufficient quantity or in the right format to cause a health effect. If I brought in a lump of coal and put it on the table at the front here, seeing that young man wouldn't share his muffins, then no one would be at risk from that lump of coal. If I aerosolise the coal and blow it through the room, obviously it's a different process. So the exposure pathway must exist for harm to occur. Even if the exposure pathway exists, and it is capable of causing negative health effects, usually proposals are capable of being mitigated so that we can overcome those negative health effects as part of it. The second principle, and I heard earlier this afternoon that you haven't had a look at the Sandman videos yet, but you should all look up Peter Sandman at the end of this talk and have a look at his website and look at the whole principles of risk communication. And one of the most important principles is that risk equals hazard plus outrage. And so this is not just a matter of, is there enough toxic chemicals to cause cancer? Obviously there is a risk associated with this proposal, the fact that dozens and dozens of doctors are collaborating to complain. More than 10,000 people have signed a petition saying they don't want it. A number of local governments have passed resolutions saying they don't want it. So the degree of outrage out there is significant. Hazards are often capable of being mitigated, as we said in the last slide. The fact that there's a hazard doesn't mean you can't control for it. Also, outrage can be managed quite comfortably. The way to manage outrage is to have a process for consultation, transparency, and then trust by verification. If you say something doesn't matter, have some mechanism of proving that the public can monitor as they go forward to make sure that what you're saying is actually something that they can believe in. And he gives lots of great examples about incinerators with LED temperatures that everybody in the town can see, so they know it's burning at a hot enough area for the public to be reassured that they're not all sucking in dioxins or something similar. The third and final principle is that the Public Health Act conveys powers, and those powers are significant, and they rest with medical health officers. they require me to report to my municipalities health hazards. So if I believe Fraser Surrey Docks constitutes a health hazard, I'm required to report that to the municipalities and the people in the area. I can require mitigation of risk. So I have the powers to say you must stop doing something if a hazard exists. And they are very, very broad powers. An example of how broad they were last year, during the midst of a measles outbreak, a pertussis outbreak at that stage, whooping cough, a company that manufactures natural products put an ad in the newspaper saying, you don't need pertussis vaccine, you can have oil of oregano, and that stops pertussis. Now, I didn't believe that oil of oregano did that at all, and we put a public health order on the company, and they had to withdraw their statement and put a public apology in the paper because we said they had created a health hazard by encouraging people not to have vaccine at the time of an outbreak. So the powers are quite significant. That company then moved on and started advertising the virility enhancing capacity of their product instead of the disease control capacity of their product. And so I think it's, anyhow, I won't comment on that part. The one problem with this aspect is that the problem needs to be realised for public health staff to use public health powers. And so the issue that we're having at the moment is that there is a proposal. Nothing's happening. I can't make them do anything under the Public Health Act because they aren't actually pushing coal into anybody's lungs or doing anything else. So the Public Health Act only works when the health hazard exists itself. Okay, let's talk about the proposal. There is an area of Wyoming and other parts of the United States called the Powder River Basin, where they like to dig up coal and give it to other people. And they put that coal on different rail yards, and the one that we're concerned with is the Burlington Northern Santa Fe Railroad, and it ships it to areas along the coast of the US, through Oregon and Washington, past Seattle, and then up to different parts of British Columbia. And the current proposal is that they will ship this to Fraser Surrey Docks, and then from Fraser Surrey Docks it'll go in barges down the river and it'll go across the Straits of Georgia to Texada, where they'll load it on big ships and they'll give it to Korea and to China. We've had lots of coal exports in the lower mainland, largely from North Van and West Shore. It's Canadian coal, it's a different type of coal, it's metallurgic coal, and the areas there are used to it. And in fact, West Shore spent $7 million in the last year or two increasing their dust suppression because of concerns about the exposure from their stockpiles. So this is a new facility or a new handling of an old facility which has never had coal before, and it's going through a whole lot of areas that haven't had this type of coal expose their populations. The proposal is currently for 4 million tonnes per annum, but it's a permit that will allow 8 million tonnes per annum. And there is at the moment something like 200 million tonnes per annum proposed additional West Coast export, which is Hello? You want me to keep trying? Yeah, keep going. There have been significant reductions in the funding provided to higher education over recent years. The ability to have microphones that maintain for a whole 60-minute talk is particularly challenging under the current fiscal arrangements. So, why are the public concerned about this proposal? Firstly, the benefit accrue to a small number. It is almost inevitable that people are unhappy. Thanks. Hello? Hello? Is that working? Yep. Okay, sorry, I should have warned you right at the very beginning. I am familiar with neither of the official languages of Canada, and so this talk is in Australian, and obviously it's going to go in and out depending on whether any of the microphones work. So the risks and the costs are shared out to everybody from when it crosses the Presarch border all the way to Fraser Surrey Docks, people up the south coast, people on Texada Island that are going to have a bigger stockpile. The benefit is 25 jobs in Surrey itself. And so the large part of the concern is the US gets the benefit of selling its coal. There are 25 jobs in Fraser Surrey Docks. The benefit to everybody else is pretty insignificant, but the risk and the health impacts, if there are any, go widely through large amounts of communities. The costs include possible health effects. At this stage they're not quantified, but there are people concerned about the potential for this proposal to adversely impact the health of some. There has been resistance by the proponent and by the regulator to mitigation processes. I'm not sure that we would be having a discussion today if they'd made a decision that they were going to cover the rail cars, cover the barges, and just say, look, we're just going to make sure no one actually breathes any of this stuff in. There would have been people who were still unhappy about climate change and digging it up. There would have been people who are unhappy about diesel exhausts, noise, rail crossings and so on. But if you take the coal dust out of the equation, it would have been much harder for people to run a campaign saying we don't like this. They're not willing to do that, and that's part of the reason that we're in the situation we're in. There is a lack of transparency or acknowledgement of concern. And I talked earlier about how you minimise community outrage. A lot of this has actually been, I think, a poster child for the way not to do a whole lot of stuff. And when they released their most recent environmental impact assessment without any consultation with health departments or others, immediately the Mayor of White Rock was on the radio and in the media saying, well, we didn't even know they were doing it. They didn't send us a copy. Don't they think that we have some input into the process, seeing they're going to run their trains right next to our beach? In addition to that, there is a component of the resistance which is an anti-coal component. It's not part of the public health assessment. My job is to protect the public in Fraser. It's not to solve the world's problems with climate change, war in the Middle East or anything else. But there's a whole group of people who don't want this proposal because they don't think we should dig coal up at all. And they're never going to be happy with anything that occurs. And you could cover the rail cars and they'd still be unhappy. So there is a concern from a whole group of people that's part of it. And this is why there's a concern. These are the general health impacts of the coal industry in general. So not just rail cars or shipping it out, but what happens when you dig it up and what happens if you live near a coal mine or you're a coal worker or something. And there's a long list of these things because of the different products involved. So particulates, sulfur dioxide, ozone, heavy metals, benzene, radionuclides, they're all part of this process. They all lead to reduction in life expectancy depending on the exposure pathway. Particulates, SOx and ozone will increase respiratory hospital admissions. Coal dust produces miners' pneumoconiosis, or black lung, if you like. Particulates and carbon monoxide produce congestive heart failure. There are cancers, osteoporosis, renal dysfunctions from benzenes and heavy metals. The particulates can give you chronic bronchitis. The mercury, which is present in some coal substances, does nasty things to the brains of young children. Apart from that, there is degradation and soiling of building that can affect human health. and there's the issues of global warming and ecosystem loss and degradation. So the whole principle that some people are saying isn't a time we stop digging this coal up and burning it in power stations relates to not just the climate change, but a whole lot of risks associated with coal industry itself. And these are the sorts of things that we see in some places, although that's not what the proposal will be at Fraser Surrey Docks. Big stockpiles of this stuff are sitting around, and this is one of the coal trains that makes people unhappy. And there's a video that we'll show you towards the end of what happens with the coal trains at the moment going through White Rock, and you can see the plume of black stuff coming out of the side of the train, and the video shows it very graphically at the time. Different people are vulnerable to a different extent, and like a lot of the things we talk about in environmental health, children, the elderly, those with pre-existing conditions, either heart or lung, diabetics, and the workers at greater exposure are all vulnerable. So in this particular situation, what is the risk assessment and what are people worried about? Clearly they're worried about the trains and the fugitive losses. I mean, this stuff is going to permeate right across the lower mainland where the trains are running. They're worried about the fugitive losses from the barges, and particularly in New Westminster, which is right over the road from Fraser Surrey Docks. The schools over the other side of the river, the residents over the other side of the river are worried that this, with the prevailing wind, is just going to blow off the barges straight into their backyard. They're worried about the fugitive losses at the site. They're worried about stockpiles, and they're also worried about the wastewater. And so, one of the proposals was that in order to stop the dust blowing off the rail cars on their trip home, they will wash all this down with millions and millions of litres of wastewater, which will sit there somewhere, and then plausibly they'll stick it in a sewer or do something else with it, and we'll have to deal with it in that particular way. There are issues to do with the transportation. There are data that says there are much higher air toxin levels along the path of these sorts of coal trains than are recommended, and there are also data about the coal truck incidents that we see at different times from the point of view of derailments and others, and we've had them in the lower mainland as well. So apart from the airborne and water pollutants that we've discussed, there is an issue to do with diesel exhausts. If you run lots more trains through our residential areas, then obviously there's more diesel exhaust, and we're going to spend a bit of time on that. And there are other issues to do with increased train traffic. There is noise pollution of the trains as they go through, and there's an issue to do with delays at rail crossings. And so if you go down the White Rock area, when the trains run through, there's one part of White Rock that's actually totally cut off from the rest of it. So if someone has a heart attack or a fire or something on the other side of that, while the rail train is going through for 8 or 10 minutes, there is no access to that part of it. So people are saying you're taking away our access to emergency services, and these are significant not just from emergency services. There was a similar but larger proposal that got knocked back at this point over the border in Washington State, the Gateway proposal. They estimated that just the trains going past was going to produce a decrease of around about $380,000 in productivity from all of the people that were going to sit around in their cars waiting for the rail crossings to be opened up so that they could get to the other side. And at one point there, they were talking about the fact that they would have to move one of the fire stations in order to make sure that they could continue to provide a service because of the rail trains that were going to be going past. And obviously the issue to do with the safety of trains and ships. Everybody will see that the federal government is about to spend, I can't remember the number, $70 million or something, reclaiming the town in Quebec that they've just had the big explosion and killed the people and destroyed most of the downtown area with that. The whole issue of the safety of trains is part of a process. Interestingly, it's actually being used at the moment by the people who want to ship bitumen across Alberta and out through Burnaby as well, as saying, well, these trains are really not that safe. We should build pipelines to make sure that we don't have to put these things on trains. That's when they're not telling us how good this is for fly fishers or whatever else the Northern Gateway's current campaign is on their benefit. Coal dust itself produces chronic bronchitis and emphysema, pulmonary fibrosis through the pneumoconiosis we talked about, and can produce environmental contaminations through the leaching of heavy metals. And this is an issue for those people with agriculture down along those parts of the Fraser Valley that the train goes past, that if you put too much heavy metals into the water table and the soil, then you can start to have problems with horticulture because you can't actually continue to grow food there if the soil is heavily contaminated. And I've seen different settings over the last 30 years where sometimes on purpose we've put heavy metals into the soil and then found out that the cadmium levels or other things were such that we couldn't actually grow food anymore. And I can remember one time we put the remnants of wastewater reuse as a fertiliser onto soil and actually destroyed a whole horticultural area as part of that. This is largely affecting respiratory, cardiovascular and neurological systems. I want to talk a little bit about diesel because I think diesel particulate matter from trains is a really important topic. Diesel particulates increase all-cause mortality, impair pulmonary development in adolescence, produce pulmonary inflammation, increase the severity and frequency of asthma, ER visits and hospital admissions, increase the risk of acute heart attacks in adults, and increase the risk of cancer. The particulate matter largely does it through its very fine particles, the respirable fraction that's getting into the lungs. And once they get into the alveolar space, which is largely those that are smaller than 2.5 microns, they can't be cleared by mucociliary action. The health effects of this are really well known, and they're part of our generic concerns about pollution in urban conurbations. Long-term increases in exposure to these very fine fractions has been associated with an increase in deaths due to heart disease, an increase in acute cardiovascular events, an increase in the work that your heart has to do, the left ventricular mass, and a decreased arteriolar diameter within your retinal bed. So it has impacts on your vision as well. That's in long term. In acute exposure, there is an increased chance of a heart attack in people who are prone, with an increase in very fine particles in the atmosphere, and there's a whole lot of other stuff to do with cardiovascular disease that we're not going to cover today. It also has significant health effects, particularly in children, and this is one of the papers that talked about decreased lung function in developing children if you're in an area where there is higher levels of particulate matter of very fine particles. Per body weight, children eat more, breathe more, and drink more than adults do, and any health-related exposure is greater on them than on adults. And part of the discussion that Health's been trying to have with Port Metro is a proper assessment of which groups are the most vulnerable groups in the area that the trains and the rest of it is around, and what are we going to do to protect those particular groups. Particulate matter and respiratory health. If we increase the amount of particulate matter through things like increased diesel exhausts, then we increase the likelihood that they'll be admitted to hospital with asthma, increase pneumonia and bronchitis, and if it elevates chronically, then the chronic cough, bronchitis, cold and the rest of it increase. Even with a 1 to 2 hour increase in particulate matter, there's an increase in the risk of heart attacks, and there's an increase in daily changes of respiratory health. And this is a slide about disability adjusted life years associated with air pollution, and you can see that a significant proportion of the cardiovascular disease is due to the ambient particulate matter. Okay, let's just touch on a couple of other issues to do with this. Noise exposure is one of the things that was requested to be put into the health impact assessment. We know that Excessive noise produces an increase in blood pressure and arrhythmias and cardiovascular disease. It's associated with cognitive impairment in children, with strokes, with an increased rate of accidents and injuries, and exacerbation of mental health disorders. We have no data on your generation, and maybe we need them. I suspect that the whole impact of noise on populations has changed since generation, what are we up to now? Y, Z, or what are you people? I forget. But I just noticed how dangerous it is now to walk down a footpath. Has anybody here walked down a footpath recently? Young children have lost the capacity to walk along a footpath without doing something else. So everybody has something in front of them and they're using their thumb. And so it's not possible to walk and not play with your iPhone, your iPad, your whatever it is. Yep, I don't even know the names of them. You're all on something that I don't understand. Yep, Pinterest or something or other, or Facebook or whatever it is. Yeah. So maybe this whole issue of stress associated with noise exposure doesn't apply to you because you're so busy off social mediaing or whatever it is nowadays. The emergency vehicles we've talked about as part of the health impact assessment, that's not there. And so the question is, okay, we know there are problems with coal, we know problems with noise, we know there are problems with diesel fumes and so on. So what? What does that mean? Yeah. Coal dust, diesel fuel, noise can all harm health, but what does it mean for Fraser Surrey Docks? Because we need to remember exposure pathways are important. The fact that something exists doesn't mean it exists in enough of a concentration and in the right area to actually cause health effects. So is there an exposure pathway, and are there broader health impact issues that we should be looking at for this particular process? So let's talk about health impact assessment. I don't know whether somebody comes and talks specifically about this topic to you at some part of this, but this is becoming really, really important as part of the overall process of how we assess major proposals and how we look at, the balance between things that are good for the economy and good for business, and whether or not these things are good for the public and whether they're bad for the environment and a whole lot of other things. And so this is the definition. It is a combination of procedures, methods and tools that systematically judge the potential and sometimes the unintended effects of a policy, plan, program or project on the health of a population and the distribution of those effects within the population. This is not a tick, yes or no. Health impact assessments identify appropriate actions to manage those effects. And let me give you a couple of examples. You would have seen some information in the last day about the waste to energy facility and the fact that they've identified some sites. Vancouver Council's already said, not in my backyard. They're way behind the Fraser Valley Regional District, who said we're never having one of them in the Fraser Valley ever, many years ago. And part of it relates to the type of waste to energy. And we've asked for and received a guarantee that there's going to be a full health impact assessment on the proposal, and that will look at a whole range of things, including the air quality and others. But it starts with an understanding from health authorities that this is not an either or. This is not a yes or a no. Waste exists. So you can't say I don't like waste to energy or incinerators unless you're going to say I love landfills or I love something else, yeah? Because at the moment this thing that says we shouldn't have waste just ignores the fact that waste exists. So this will be assessed not against is this a good idea or not. It'll be assessed against how do we get rid of the hundreds of thousands of tonnes of waste we produce. And at the moment we've got one group saying Holland recycles all their waste. And that's good, and I'm proud of them, yeah. But we're not Holland, and we don't have that capacity. So that when we do the health impact assessment, we'll look at the risks associated with the air pollution associated with large mass burns or gasification or whatever they decide. But it has to be in the context of we still have to get rid of the waste, yeah? And we've run out of landfill space and we're not sure that landfills are good for you either. And so that's the context. It's a different context to this, which is why there's so much angst, where we actually don't have to sell America's coal. They can do whatever they like with America's coal. We're not generating the revenue from that. So the benefit of this is not getting rid of lots and lots of waste. The benefit of this is 25 jobs in Surrey. There's a similar process happening at the moment with something called the Patello Bridge. Now, all you people probably live downtown and you've probably never heard of this, but once you get the other side of a place called Burnaby, there's a thing called the Fraser Valley. And surprisingly, more people live out there than live this side of Burnaby. Yeah, there's about 1.7 million. It's called the Fraser Health Authority. 500,000 live in Surrey alone. Now, the problem with the 500,000 people in Surrey is they often like to go to Vancouver. Yeah, and when they do that, they like to, well, they used to drive down a thing called Highway 1, except it's always really busy and it's blocked, and there's this generation full of roadworks that seems to never get anywhere. On top of that, they now charge you to go over the Port Mann Bridge, which means no one goes over the Port Mann Bridge anymore because it's really quick, costs you $3 or whatever, and then at the end of it you just hit the same congestion in Coquitlam as you always hit in the Burnaby Lake. So you have a very quick trip over a bridge, costs you $3, and then you crawl all the way in. But the issue of that is people now actually use something called the Patello Bridge because you don't have to pay $3 and it's no slower than anything else. And it means that everybody in Surrey ends up in a place called New Westminster who don't like this tolling on the Port Mann Bridge because even more people are in New Westminster. And they don't like the fact that they're really not actually having people come to shop there or anything. They're just people who want to drive through their town in order to get to Vancouver. So Surrey want to twin the Patello Bridge so that the people in Surrey can even more quickly drive through the middle of New Westminster. And New Westminster Council think they don't want to twin the Patello Bridge because why do they want more of this? They've just got this damn Fraser Surrey Docks proposal. Yeah, they're going to have 25 jobs in Surrey, then they're going to blow all their black stuff across the river into New Westminster. Now they want to give them all the cars as well. So there is again a health impact assessment which is going to look at that. And hopefully what it's going to look at is not just what's the best way of moving those and should we build a bigger bridge or a bigger Massey tunnel or a bigger whatever, but what's the role of transit in this process? Why can't we get, if we're going to do this, fast bus lanes and more transit and better bike paths and all of the rest of it? Let's look at the overall health impact instead of just how do we move cars from A to B. Now this of course is anathema to everybody who lives at UBC because they don't care about transit in the Fraser Valley because they've got the Broadway corridor and they think we should spend $3 billion giving you a light rail so you can all go to uni more quickly. And particularly in winter when you've got to wait for your bus. Okay. There are 5 steps to a HI. I'm not from well, actually I do live in Vancouver, but but I don't use the Broadway corridor. So there are 5 parts to a HIA. Yeah. Screening. You need to get a group of people together. You need to set up a steering committee and decide whether a HIA is useful or warranted. You need one for waste to energy, or major transit decisions, or coal trains in areas they've never been. You then need to scope it. You need to define what is the work plan that you're going to do. You need to then look at what is the quantitative and qualitative impact of the proposal that's on the table. You then have recommendations which include mitigation strategies to improve health. Cover the roll cars, cover the barges, don't have a stockpile, increase the mitigation from the dust processes. And then you have a reporting process, a transparent account of the HIA process addressing the audience needs. 5 steps. Sounds simple. It's quite complex when you get to each bit about what you're going to collect. And one of the critical things is that the steering committee and the rest of it is independent of the proponent. Yeah? That this is not something that the public are ever happy if the proponent says, I think I'd like to ship coal, and then it says, so I'll do an environmental impact assessment, and then I'll give myself a big tick, and the public will be reassured because I gave myself a big tick. You're all much too young, but when I was your age, there was a company called British American Tobacco, and they did lots of assessments of something called cigarettes. And it's astonishing that they never found a single problem with cigarettes that they shared with the public. I mean, they actually had some data we found out afterwards that suggested that cigarettes weren't particularly good for you. But allowing proponents to say, I've had a look at this and I'm comfortable that I should go ahead and do something, is not something that the public particularly trusts. A comprehensive health impact assessment, when required, reviews available evidence along with collected data and analysis of new information. It is a collaborative community process, and that was the statement from the National Association of Community Health Officers in the US, along with the CDC in 2008. Here are the 8 stakeholders required to be involved in a health impact assessment. Community-based organisations, the residents affected, service providers, elected officials, so the municipalities that are screaming they're not even talking to us, small business, industry developers and big business, public agencies, and provincial or national advocacy organisations. If I look at the environmental/health impact assessment that's just been released by Fraser Surrey Docks, number 6 was involved in doing it, industry developers and big business, and part of number 7, the federal regulators. Nobody else had anything to do with the design, the conduct, the outcome, or what they're reporting, which is why there's still so much angst. So, who were the stakeholders? Certainly not the health department, certainly not the public. And we wrote, starting last December, continuing through a very detailed letter in May, to Port Metro Vancouver saying, we want a health impact assessment. Here's a list of the 6 things that should be there, and we want you to talk to us about the design. We can help you sort this out if you work with us, so we can show the public that an independent review of this has said it's all right. And I remember spending $25 buying breakfast for the head of FSD to say, work with us on this and we will get to an end point that everybody will be comfortable with. And their response was to ring the Minister for Transport and say, he's anti-coal, can't you do something about him, as part of the response. So, their assessment is restricted to the site. Port Metro Vancouver says, we're only in charge of the port. Therefore, we aren't asking and can't ask Fraser Surrey Docks to look at the train between Peace Arch and the barge up to Texada. We're only going to look at that. There's a moving target. Every time we whinge in the media, they change something on it so they can say, well, it's different. That's good at times. So we're starting to see some improvements to what they've proposed. They started with a stockpile in Surrey, which would have meant that every time there was a wind, it would have actually blown coal straight into the schools in New West. Then they said there is no stockpile, but the permit allowed for a stockpile 8 days a year. And when we said, how come the permit allows it? Then they said, all right, there'll be no stockpile. So that's an improvement. But they don't have a mechanism at the moment, apparently, of stopping the trains. You know, you dig it up and you put it on a train and then the trains keep coming. And so in high wind and bad weather conditions, the barges can't move. And if the barges can't move and the trains keep coming, somewhere there is coal. Now, in the past, they said we're going to be allowed to have a stockpile because of that. Now they're saying, well, we don't need a stockpile, but no one's particularly clear where the coal's going to be. It's either going to sit on a barge or it's going to sit on trains or do something. So at the moment, we're pleased there's no stockpile, but we want to know what's happening with the coal that's going to come anyhow in the bad weather conditions. They're picking the low-hanging fruit. You know, so they're saying, well, we can fix this little bit and we're just going to ignore all of the rest of the stuff that's there. So we're pleased that there's movement. We're very disappointed that it's minimal compared to what we are. their assessment, their independent assessment of whether or not there's a problem relies on statements from industry itself. So Burlington Northern Santa Fe started in the original discussion saying, we put surfactant on top of our rail cars, and the surfactant on our rail cars reduces the loss by 85%, and any loss there is occurs in the first 5 kilometres from the mine. So therefore, no one needs to worry because there's no coal dust leaving our rail cars because of the cover we put on it after the first 5 kilometres. And then as soon as they came out with that, then we started seeing all of the YouTube videos, which is where you youngsters come in. Yeah. And so can we show one of them? How does that work? Sure. Will it come on the screens? Yeah. Okay, we're going to try and show it. But essentially what it was, almost the next day after they said there is only loss, there were YouTube videos of trains going through White Rock, which essentially showed this massive plume of black stuff following the train as they went along, and there's been a number of them. And then the Vox Pops, all the people sending in tweets and emails saying, I live in White Rock. If I put my shoes on the balcony, they're black, and I've got to scrape it off the next day. There's a guy there with a six-pack. The girls would probably prefer you to play that particular video instead of... And so, as an elderly Australian transiting Canada, one of the interesting things has been, the fact that people are so unhappy about Rob Ford, whereas I thought it was actually a national pastime, this sort of process. So they're setting new public health guidelines for British Columbia. And one of the public health guidelines is that we should reduce the number of children aged 14 who have smoked marijuana down to 60% in the next 10 years. Think about that. That as a public health aspirational target, we want to decrease the amount of marijuana smoking so that only 6 out of 10 14-year-olds are currently smoking dope. Why are you worried about Rob Ford? I mean, the whole country's... It's not going to work. Let me skip it. There you go. You can... We can't find the video, but you can find some guy with a six-pack, and if that's no good, there's a friend request if you're looking for a boyfriend at the moment. Let me go back to that. There we go. Okay. The other aspect which I spoke about briefly earlier was that the fact that people have to sit around at rail crossings in their cars actually does damage to businesses. So there's lots and lots of different people who are affected by the overall process. And I just want to give a couple of examples of what should be in the overall health impact assessment. If we're talking about diesel emissions and trains, there should be appropriate estimates of air pollutant concentrations. They should be under normal and poor air mixing conditions, so that if there's different temperatures, there should be health impacts estimated for those that are most susceptible, and we need to take into account the disparity in those who will be most affected. The Port Metro Vancouver report talks about a very limited review done by one of my very, very past predecessors 15 years ago, saying he couldn't find anything. I mean, the methodology at that point was they looked at health data and said we can't see a difference in that area from it. It's being used to say this has been cleared by health departments. Similarly, we need to look at the specifics of the coal pollutant concentrations. Where is it? How far from the railway does it actually impact? We need to understand the components. Now, we've asked for this and it hasn't been provided. This coal stuff is not sort of like carbon, you know, condensed carbon. It contains a whole range of other impurities, you know, heavy metals and various other substances. And we want to know how much arsenic and mercury and the rest of it is in the stuff that they're shipping, and what's the chances that that's blowing. I mean, I think a good example, good comparison is most of you will be familiar with those little e-tablets. You know, when you go out on Friday night at 2 o'clock and you're getting tired and you think, I want to keep partying, then you take one of those little, they make that stuff in a bathtub, yeah? And there isn't, it's not sort of like, you know, Master Chef, this is exactly how you do it. It's random components they toss into the bathtub and then give to you at 2 o'clock in the morning. And so this is the same. You know, the coal's not made in a bathtub, but we're never really sure what's in there, and we want them to tell us what's in there at that. The other issue is, do we care about amenity? Yeah. If you live in White Rock and you have just put in a solar panel because you believe in, you know, assisting with clean energy, and your solar panel doesn't work very well because they keep blowing the coal dust on top of it, does that matter? If you have to clean your roof more often, if you can't hang your washing on a line anymore, then is that something that should be taken into account overall in a health impact assessment of this? Okay, we're close to the end. I want to talk roughly about managing community outrage. And I said earlier, the salmon videos are really good about a process that says what infuriates a community and how do you have discussions about them that say we are listening to you or not listening to you. We have lots of equivalency examples and we're very careful when we use them. Nobody is outraged about the local takeaway shop, but the local takeaway shop does more damage to people's lipids and kills far more people than radon at the back of people's houses. Everybody worries about radon. You can't see it. You're not sure what the hell it is. It's pervasive. It's killing you when you're not even noticing it. No one cares about the fact that, you know, the average Big Mac is 780 calories and that, you know, 3 of them a day is enough to, you know, give you a heart attack at 41 or something similar. So community outrage depends a lot on a whole range of factors, including whether or not it's imposed on you at any particular time. And you need to be careful when you're talking to the public about, don't give examples of things that God does, if that's bad, because people will decide that if God does stuff, then that's fine, he's doing stuff. And that doesn't mean you can do stuff that's bad too, because it's only as bad as what God's doing to you with radon or something similar. When I was part of a radionuclide ethics committee, people would do studies on things like how much milk influenced your bone density, and they would x-ray bones, and they would say that the x-ray, the damage you'll get from being part of the study was the equivalent of smoking 7 cigarettes total in life, or flying on a plane to Paris, because as you get up in that atmosphere and whatnot, you get more radiation. And these are the same sorts of things we can say here. But the reality is people will choose to fly to Paris, yeah, even if it has radiation impacts and they're going to have health impacts, because it's fun to fly to Paris and it's fun to be in Paris. And we don't think that's the equivalent of saying, well, it's no worse, you know, breathing coal dust for a day or something similar. So you cannot manage community outrage when there's a whole bunch of climate change people who are saying, we don't care what you do, we just don't want you to dig up the coal. You have trouble managing climate change when this is going to affect thousands and thousands and thousands and thousands of people, and 25 people will get a job. Yeah, so the benefits are too small for the group. But if you run a process which Port Metro are running, which is non-inclusive, we're not talking to the mayors, we're not talking to health, we're not talking to anybody else. It's non-transparent. We don't know what the design of the study was. We don't know how they got their information. It's minimalist in scope. It doesn't address the things we talked about earlier. And your response to concerns is to shoot the messenger. Yeah. So the first time we said as a health department, we're a bit worried about this. We think we need to have a discussion. They rang my boss, the chief executive officer, who said, sorry, but it's the Public Health Act. I can't make him behave. Then they rang the chief executive officer, the chairman of the board. Then they rang the Minister for Health. Then they rang the Minister for Transport. And then they rang Perry Kendall and so on. So the process is, we don't want to listen. We think the opportunity is to just keep, hammering away that these health people are anti-development, anti-industry, not responsive. They'll have a meeting when we're not available and say they don't even come to meetings and so on. This is almost the opposite of what you should do if you want to manage community outrage. And they're really working on the principle that, if you're the federal government and you decide to do something, it's pretty hard for these people to actually decide that you're not going to do it at that particular point. So where are we now? They tabled their new report for 30 days of consultation. Health departments, Metro Vancouver and the public are looking at this and they will make comments. At the end of that point, I suspect Port Metro will say this can go ahead and we'll have to look at whether we can modify this by using air quality restrictions through Metro Van. I'm happy to take questions on anything other than my commentary about youngsters nowadays.
I'm just going to switch mics with you here, because I need to pass that one around while we take questions, but that one's up and running again.
Well, thanks very much. Really excellent presentation and very, very informative. I wonder if you could talk a little bit about from your position as a medical health officer, where you would come down on, let's say, offsetting with other health amenities or health benefits, a project that would or could cause health degradation. Could that be offset? And is that sort of a principle that could be followed?
And I think as a general principle, they do look at that process. And there have been times when you might say, I'm going to take a piece of parkland for a development process or something, and the mitigation is we'll plant 2,000 trees somewhere else, or we'll open up something, or we'll build a bike path. I think that something that has a negative impact itself doesn't stop something. It means you want to try and minimise the impact and look at benefits. I think the challenge here is there's so little benefit from this particular proposal that you really don't want to see a lot of health impacts, because it's 25 jobs, which is why the reason Surrey Council itself passed a resolution against this going ahead. It's hard to see what you'd be doing here to increase the benefit of a process that impacts so many people along a wide corridor.
Maybe just a follow-up. I mean, so what if you, for example, they were required to build a community center or build parks or greenways or something like that?
And we've looked at those things, and I think that the public are responsive to that if they're involved in the discussions themselves. Again, the specific challenge here is the train starts at Peace Arch, runs along White Rock, South Surrey, and ends up, and so what would you be doing from that particular process? There has been a proposal to actually take the train right out of that area and run it through a different part of the lower mainland so that it avoids all that stuff. The challenge of that is the rail's actually owned by BNSF. The railway is owned by the people running the rail cars, and so it's challenging to just say, well, we just move this or do something different.
Thank you. I've actually followed this story for a while, and it was a topic of presentation for one of my classes. So my question is, okay, first of all, I don't have any strong position on this. I just try to look at it objectively. I've seen the video that you referred to, and there were some suggestions from the comments that the video is not real.
The video, which, sorry?
That the video is not real. I was sort of a doctor. There are suggestions, I don't know for sure, but I've seen that. So, but my question is, if I understand correctly, all that FSD is asking for is an expansion Is that correct? And if it's an expansion, so what are they doing now with the coal that they ship now?
They're
I
not.
mean-
Okay. And so there are places that ship coal, but they're not FSD. And so this is an expansion of activity in the port, but it's the first time FSD will ship coal. So there is no coal at Fraser Surrey, and there's no coal on, of that type on those trains coming out of that area. So this is a new facility activity. They're having to build new things there to handle the coal, and this is going through an area that never used to have this particular coal. And so that's the issue for Fraser Surrey and these people.
One more question.
Sure.
Like, I agree with you that if we hold these people responsible and they cover up the coal, it might go a little easier for them. But I read that the Neptune terminal on the North Shore, they got approved for the same thing.
Yeah.
So what's the difference?
Well, the difference is that they did it under the table. And so when we went to port, when my colleague downtown who owns Neptune, Paddy Daly, went to them and said, we're worried about Neptune being expanded, Port Metro Vancouver said, too late, we already ticked it. And so now the discussions with Neptune, and now the people on the North Shore seeing all this are going, well, why do we have to have the black dust? And so at the moment what's happening with Neptune is that they're trying to use Metro Vancouver and the airshed and the air quality permits to get a review of what's happening in Neptune as well. But because they're the federal government and they can permit ports, they did that without any reference to health authorities or anybody else. And so you're right, Neptune exists and Neptune's being expanded, but it happened without anybody knowing that the proposal was in and that it was being ticked. I want to go back to what you started with saying. You said you have an open mind. I want to remind people, I don't know whether this is good or bad. It may well be that if they did the health impact assessment properly, that we would have a look at it and say, look, there's really not enough dust blowing on anybody and there's not enough risk, and therefore we don't understand why there's community outrage. The community outrage is that they won't assess it the way we want them to, and they won't make that a public, transparent process. And that's what annoys people. I'm not at any stage saying that the data from diesel particulates or coal or whatever, which is real, applies. The question is there an exposure pathway? And the answer is, why don't you have a look at it properly for us so that we can say no and reassure everybody?
My other question is, where is the coal that's now going along the White Rock waterfront going to?
Well, from what you're saying, so the issue is that the coal that's coming into the lower mainland at the moment is Canadian coal that goes down a different pathway. And so that we're not shipping BNSF coal along that line to where they want to ship it to. And really the issue is twofold. Firstly, and I don't know if this will continue because there's actually changing economy in the brick economies. That this was a proposal that they wanted to put a total of about 200 million tonnes extra out through the west coast to ship across there. At the time they were doing that, they were getting more for their coal, and the demand from India and China was higher than it is today. I mean, even in China, they're starting to think about the pollution in their cities and the coal-fired power stations, and they're trying to actually decrease the amount of dependence they have on coal. And so a lot of this started with a process that said, we have a window of opportunity, we want to ship this as quickly as possible. There were 6 proposals in Oregon and Washington State. None of them have got up yet. 3 of them they've given up on from the point of view of partly economics and partly because it's so difficult. The biggest one, the 48 million at Gateway, has been sent off to a very detailed health impact assessment that'll probably take 2 years. And they've got massive documents about how they want it done and everybody's involved. And I think that frightened Port Metro and Fraser Surrey Docks because they thought if we have to go down all that pathway, then it'll stop the proposal, so we're just going to ignore them and do our own bits at the moment. But we don't run that, and the issue for the local people is not the 4 million tonnes, but is at the start of the fact that if they're not going to let it happen in northwestern US, then we become the gateway for everything that people are saying is something we don't want to see anymore in the top of the United States.
So you're saying that at the moment there is no American coal being shipped through British Columbia?
Not that I'm aware of.
Okay. Great. We're out of time. I can wrap this up. Thank you. Yes. Thank you very much, Paul, for a very interesting talk. A fascinating problem from many points of view, and it'll be interesting to see how this story unfolds over the next few months. Thank you.